Great.
This meeting is being recorded.
Okay, awesome. Well, welcome everybody. Welcome to our webinar. We have put these together every month to really give you more face time with the doctors here at Green City Dental, whether you're an existing patient and you just want to hang out with us more, or you have questions about your treatment, or you just didn't quite get all your questions in. This is a great platform. Or if you're a new patient and you are trying to figure out if we are a good fit for you, or if you're just curious and want to ask a dentist, this is what this platform is all about. So welcome everybody. And if you have questions, please put them in the chat box, just so that we want to make sure that if you have specific things that you want to talk about, that we have time to get to them. So if you have or topics, certain topics that you want us to talk about, happy to do so. So please put those in the chat box if you can. And if you can't figure out how to put it in the chat box, then just raise your hand and blurt it out. So
we do have one question right now that somebody else asked. Last time we mentioned that toothpaste is optional. And then the question is, why is the toothpaste optional? Shouldn't contain xylitol and not have sodium lauryl sulfate to best clean the tartar and plaque of your teeth? So one of the things is that we have said many times is that toothpaste should be used depending on what you need. So if you need remineralization, we want to recommend something that is going to help remineralize the tooth structure. If you have an imbalanced microbiome, if there is a lot of activity, we want to use a toothpaste that is going to help balance that microbiome. So depending on the needs, that's what we are going to be recommending. And then Dr. Taylor mentioned that the toothpaste is optional because what really removes the plaque is the mechanical action of the toothbrush or the brushing. So there's a lot of different ingredients that we do not like in the toothpaste. And then there's some that are really beneficial. So definitely that sodium lauryl sulfate is something that we don't want. There is also, of course, fluoride. We do not recommend fluoride. We do not recommend to have triclosan in the toothpaste because that is an ingredient that has been found in toothpaste and is also found in antibacterial soaps and cosmetics. But then according to the FDA, there is a decrease of function of the thyroid if we're using triclosan. So we want to try to avoid that.
Yeah.
Then artificial sweeteners. A toothpaste shouldn't have to have sweeteners. There is no need. It's not food. We don't need that. And there is another ingredient is the DEA, the diethanolamine. It's a product that makes it foamy, makes the toothpaste foamy. And then it's actually, I believe they use it in an antifreeze fluid for the brake fluid, which we don't understand why they have to put things like that are not really beneficial and they can cause more harm than benefit. So then let's look at the list of the ingredients on the toothpaste. But if you want to use something that is beneficial, Dr. Taylor can talk more about that of the toothpaste that we are recommending.
Yeah. So first of all, it depends on what your problem is. So if you have decay, if that's your main issue, then that's going to be a different type of toothpaste than we recommend if you have like a periodontal issue. Okay. And we do a lot of testing in our office. We actually take a little microscope slide of your plaque. We look at it under a microscope, and that allows us to identify what kind of bacteria and different pathogens are in your mouth. So if we see a lot of really nasty bacteria or we see parasites, then we're going to recommend something that's a lot more strong than something that, if you don't have all of those bacteria, okay? Bacteria in the mouth are good, okay? Just like the gut, there's a lot of talk about antibiotics and how they kill off all the bacteria. And the bacteria in our body, they do a lot of really, really important things. And so we want to be very nice to our microbiome. And things like xylitol came up as a question. I'm okay with some xylitol. I don't want you swallowing a bunch of xylitol. There have been, it does kill bacteria. And so again, if we're swallowing that xylitol, that's going to kill maybe some of the good bacteria as well. And we really want to promote a mouth environment that's going to support the good bacteria and it's going to crowd out the bad bacteria. Okay, so whenever we have somebody that has periodontal disease, they've got a lot of bad bacteria, we want to first kill that off. And we might use a toothpaste to help with that, but we might use more aggressive things too. So we might have you do other types of treatments to do that. Then we want to change the environment in your mouth so that we can repopulate it and so that the good stuff stay there and the bad stuff takes a hike. Now, the interesting thing about the microbiome in the mouth is that we are swallowing about 2,000 times a day. So whatever bacteria is in your mouth and in your saliva is going to get into your gut. And so whenever we have patients that come in that have a lot of dysbiosis in the mouth, we are always recommending that we also pair that with a gut protocol because it's really hard to clean this tube, right? It's all one tube and we can clean this part, but if we don't clean this part, then we're only cleaning half of the system. So depending on your symptoms and what you present with and what your risk factors are is going to help us determine the type of toothpaste. Now, like what Isabel said, sodium lauryl sulfate and all of that junky stuff that's in toothpaste, we don't want to put that in our mouth. If you wouldn't eat that, we don't really want to put it in our mouth. So, and then if you have a lot of cavities or you just want really good prevention, we really like Dr. Jen's toothpaste. This is a 10% nanohydroxyapatite toothpaste, and clinical studies show this actually remineralizes the enamel. So you have to remember our enamel is made out of crystal, okay? It's like a lot of mineral, and every time we eat, mineral gets pulled out of our teeth, every time. And when we are done eating, all the saliva has mineral and buffering capacity, and so it buffers the acid and it puts the mineral back into the teeth. So the teeth and the body have a very smart system, but your teeth are constantly getting mineral pulled out and pushed back in and out and pushed back in. When cavities happen, this is because more mineral is being taken out of the tooth than the saliva is able to push back in. So we have to look at why are we getting cavities? Where's the breakdown here? Do we have enough mineral? Is the pH really good? How's the saliva quality? Some people are on medications and they have xerostomia. They don't have enough saliva, right? And so each of those risk factors is going to help us determine what is the right kind of therapeutic toothpaste for you. But in general, I'd say my two favorite toothpaste, if you just want prevention, I like Dr. Jen's 10% nanohydroxyapatite no fluoride toothpaste, okay, because that's going to just help keep the mineral in the teeth and it's a good insurance policy. And then I also like a product that's called Revitin, and Revitin has a prebiotic in it. So Revitin toothpaste doesn't kill anything, but it's feeding the good stuff, okay? Because we know when we kill off everything, there's all sorts of things that kind of go wonky in the body. In fact, they did a study with chlorhexidine mouth rinse, which is a pretty strong mouth rinse that they use a lot in surgery, and it kills everything in the mouth. And it kills it kills all the bacteria that make our nitric oxide. And so what they found is that these patients actually had increased blood pressure after using this mouthwash, because all of those microbes that were making nitric oxide and they were dilating the blood vessels, they all died off, and we didn't have the ability then to have that dilation. So blood pressure went up. So it's really, really interesting. And I think more and more science is coming out about how important that microbiome is. And so when you're looking for toothpaste, my advice is be nice to your bacteria and only treat it aggressively if you need to, and know what you're treating. Okay, because if you're just putting oregano oil and all these things, like even herbs, they can be super, super damaging to your microbiome. So be very careful with the kind of toothpaste that you pick.
I want to add regarding Dr. Jen's toothpaste, because I absolutely love it. And a lot of people are dealing with hypersensitivity on their teeth. They might clench or other reasons, gum recession, roots showing. And the Dr. Jen's toothpaste is just phenomenal when it comes to the hypersensitivity. I also want to make a comment too. We've got some patients that are really on a protein diet only. I mean, they're meat eaters and that's all they're eating. And it's interesting because they have a lot less plaque than people that are eating carbohydrates. And so just know that the carbohydrates is like sugar, and it sticks to the teeth, and it raises the risk of having decay. So we can go on and on too, because I'd love to talk about Weston Price and the studies that he did as a dentist going into tribal areas and seeing the decay rates there, which were hardly non-existent.
Yeah,
the teeth.
we have another question here.
Okay, yeah, go ahead.
And then we can go on that if
That's
there's
fine.
more questions. Before we move to the next question, one of the things is with Dr. Jen's toothpaste, brush your teeth normally, spit, but don't rinse because you want those amazing ingredients to be working on your teeth. So just don't rinse the good ingredients that Dr. Jen's.
Don't wash them away with mouthwash.
No, don't use that.
Don't- Don't do
this-
that.
This question is for Dr. Taylor. It says, I want to know if I can still get benefit from airway mouth work at age 78. I have tongue tie and understand I will need to get the myofunctional work first. I have read Dr. Felix Liao's work.
Leo.
Yeah. Yeah, I would say absolutely. It's never too late, really. You know, I've treated patients that are in their 80s and even done orthodontic work on patients in their 80s, and helped them with their breathing and airway issues. So, of course, there's many factors that go into airway issues. You know, a tongue tie can be one thing, but there's also, let's go back to the microbiome. There's also connections between the microbiome and sleep apnea, hormones and sleep apnea. So it depends on what your exact symptoms are and what different things you present with, but 100%. I've had several patients that are a little bit older and they want to treat this. The other thing that's very cool is that we have a device called a pharyngometer in our office, and what the pharyngometer does is it will map out your airway. It's like an ultrasound for your airway, so it sends sound waves. It sends them up your nose and it sends them down your throat. And it basically gives us a 3D model of what your airway looks like. So we can see how narrow is it, what's the volume of it. And then we know that the airway collapses when we exhale. So we actually do this test twice. We do it once with you sitting up normal. We do it once with you exhaling. And that helps us determine exactly where your collapse is happening and how flexible your airway is. So we want an airway to be nice and rigid. We don't want it to have much flex. And so when we can get an idea of how flexible the airway is and where that funnel point is, you know, all this air is coming in, where's the funnel point? That is going to be the limiting part of your airway. And then we can use that machine and we can move your jaw around and we can figure out the perfect exact position of where your jaw should go to make your airway more open. And that really gives me a good idea of, will this treatment be successful for you? If we're going to move a bunch of teeth and we're going to do all this stuff, you know, you're jumping into this treatment, are we really going to be making that airway better, right? And of course, we're looking at nasal breathing, we're looking at nutrition and all of those things as well that go along with airway stuff. But everybody presents with such a different set of things. You know, sometimes tongue ties are a little piece and sometimes they're a really big piece, and it's hard to know without seeing you clinically. But yes, I would say, you know, people are living well into their hundreds. So I guess, you know, let's make your quality of life good now. Why not?
I think it's important also to mention, the older we get, the airway is lined by muscles. And I know Felix Leal mentioned this in his book. The airway is lined by muscles. And the older we get, we tend to lose our muscle tone, and which is why you see older people tend to have more sleep apnea, although we see it in children as well. But their muscles are not as firm as they used to be. So I just think it's so important because airway oxygen is everything to overall body health. And so we really do want to make sure that your airway, anybody's airway, is wide enough to get a good amount of oxygen in it. So yeah, I encourage you to move forward with that, no matter what age you are. Right.
That's a great question. Thank you so much. There is another question that is that someone else sent. It says, how do you collaborate with other practitioners, functional doctors, and naturopaths? And why is that important? So one of the things is that we're looking at the root cause of the problem that each patient has. And the root cause is not necessarily in the mouth. We can see a lot of systemic conditions that affect the health of the mouth. So we can see a lot more inflammation in the gums, even if patients are doing a really good job keeping things under control and maintaining their oral care, oral hygiene. they're still having issues. And as Dr. Taylor mentioned, the microbiome is a really big part of it, but we have seen a lot of patients, for example, with Lyme disease, patients with diabetes, that their conditions don't improve over time. So we need to collaborate with naturopaths and functional medicine doctors to find out how we can balance the systemic health and how we can prevent the things that are happening in the mouth are going to make things worse in the rest of the body. Because we have seen that there's a huge connection between cardiovascular disease, digestive system, even Alzheimer's disease, insulin insufficiency, or diabetes issues get complicated when we're having a more imbalanced microbiome in the mouth. And I don't know if you guys want to complement that.
Well, I was gonna say, so I think part of the question is like how we do that. So number one, we've done a lot of networking with different doctors in our area, and I have screened a lot of them and I've interviewed them, and they're not all the same. So the people that we refer to typically they're using tools like ozone and other types of things, and I feel comfortable sending my patients there. I can't tell you how many times I've gotten a naturopath that's called me after I've said, hey, your patient has mercury fillings, we're gonna go ahead and take them out, and then after that, we need to detox, okay? And studies show that when we remove the mercury fillings, even if they're placed just 30 days before, we know from scans in sheep that if we place mercury fillings 30 days later, sacrifice the sheep, the mercury from the fillings accumulates in every single organ in the body, okay? This is like a study, right? That's come out. And then they did it again in monkeys and they found the same results. So when we take the mercury out, it's just a little piece, right? Like we're taking out the source, so the mercury's coming out and it's not continuously being swallowed now. We're removing the source, but now we have to clean up the body, right? And I can't tell you how many naturopaths have called me and like, what do you want me to do? Like, and I'm like, you're the doctor, right? So the doctors that we refer you to, we've talked to, they understand the mouth, they understand the connection. So that's the first thing that we do. The second thing that we do is that we send follow-up letters. So when you come in as a patient, we'll have you fill out a form that says, who's on your team? Who's on your wellness team? We want to connect with them. And we ask for your permission if we can connect with them and we can really work as a team with them. So once we see you, whatever you need, we're going to put a letter together and we're going to launch it to your doctor and say, hey, these are the things that we found. These are the things we're recommending, and we want you to support these things in this way. And would love to work with you. If you have any questions, let us know. We love working as a team. We want to be collaborative. So if you're working with a doctor that is willing to work with us and likes that type of communication, then that's awesome. I love meeting new practitioners, but the ones that we refer to, they know us. They know us personally. They know what we do, and I feel confident in those referrals. So hopefully that answered that question.
Yeah, I wanted to comment on that too, because on gum disease treatment, we're really we're taking saliva testing, we're looking at bacteria, we're looking at genetic factors, and we're also looking at yeast infections. And we do find on some people yeast, and if we find it in the mouth, it's in the whole body. So we like to work with the whole body healthcare providers because the mouth is connected to the rest of the body. And I could go on and on about other things, but I won't. I'll keep this short right now. But I think it's very important to have a dental office that gets into the whole body health of everybody. Really connect with their healthcare providers.
Yeah, and I just want to just tell a story. This is a great story. We had a patient that came in that had been suffering from a lot of black, like her teeth were staining black. She had black coming out of her gums, sandy kind of blackness. And it so happened that she had a root canal done, and the cotton roll they never took the cotton roll out. And she ended up having this stuff that was coming out of her gums cultured, and they found it was black mold. And so went ahead and took the tooth out, and sure enough, it's all black inside. But that tooth had basically, from that root canal and that cotton roll, had caused this whole black mold infection in her sinuses and in her blood. And the woman, she came in and everybody thought she was crazy. She was telling the dentist, like, the dentists were telling her, you need to brush and floss more. You're not doing a good job. You're a bad person. You need to come in and have your teeth cleaned every 2 months. I can't believe you're doing such a bad job. And she's literally like, I'm brushing my teeth 10 times a day. I don't know why my teeth are turning black, right? So it's in situations like those that you're just like, I really need a good team with me, because we can remove the infection, we can help identify the cause of what's going on. But as dentists, I can't treat a mold sinus infection, or I can't treat mold toxicity in my office. I can't detox you through that. I know a lot about it, but I can't, as a dentist, guide you through that process. So this is where, you know, some people, they don't need a lot of that support with their naturopath or their functional medicine doctor. They don't have much going on. But then other times you're like, we really have to work on this, you know. If you're coming in and there's a big problem, we got to get another doctor involved who can really help us get to the root cause, and not just that, but clean up and help your body heal from whatever you were dealing with, whatever infection was going on.
Great. So any of you here has another questions? If not, then I'll continue with the questions that we have from previous people. Okay, so there is a question here is, do you support patients before and after procedures with supplements or nutrition? So for that question, there is definitely a lot of information, and also depending on what is it that we need to support. For example, in my case, when I do extractions, it is really important for healing to just make sure that your vitamin D levels are optimal. We want them to be around 70, 80. If your levels are not there, we want to boost that vitamin D, and then we want to be taking vitamin K2 with it, because we want to make sure that that vitamin K is driving vitamin D into the right places. We wanted to make sure that when we are doing the surgery, your body is ready to heal correctly. So then on top of that, there's a whole list of supplements that we give every single patient. And I'll put it on the recording, because I feel like that's really beneficial for people to know. But one of the things is following Dr. Weston Price recommendations is really important, especially to make sure that your teeth are going to be able to remineralize. We were talking the other day with Dr. Taylor about how it is important for people to know that teeth can be remineralized in two ways. One is from the outside, so with the saliva and the good minerals that we have in the saliva, and that the tooth will absorb that and will help remineralize. And then on top of that, with the tools and recommendations, including Dr. Jen's toothpaste. But there is also another way, and is from the inside out. Because depending on what you're eating, if you're eating something that is beneficial for the repair of your tooth structure, the tubules that are connecting from the inside of the pulp, the nerve of the tooth, are going to be sending some like fluid. We're talking about microscopic processes here, but they're all going to be feeding basically the tooth structure, and it's going to help remineralize that. So using, as we were talking at the beginning, good protein is really important. Protein is important for the health of our teeth and our gums. So whole foods are really a good idea as well. Just make sure you're eating your like fish, beef, and ideally it will be pasture raised or more organic, less chemicals in the food that we're eating. Cod liver oil is another thing that we recommend, and Dr. Taylor has created a really incredible list of supplements, and even starting for patients that are really little kids, starting to have a really important nutrition is going to benefit their oral health. So Dr. Taylor can comment more, and Dr. Carroll.
Yeah, I think we do have some basic guidelines. I would say everybody's, you know, a little bit different, but in general, there are certain things that we tell patients across the board to do, which is follow more of a Western Price or more of an ancestral type of diet. Like Dr. Carroll was talking about, depending on your issue, you know, it's all about the microbiome. So if you're eating a bunch of carbohydrates or you're eating a bunch of sugar, those cavity bacteria are going to eat the way of that sugar, and they're going to poop out acid, and they're going to cause your mouth to be more acidic, and you're going to have more plaque. So one of the ways to get rid of those microbiomes is to starve them. You don't eat sugar, you don't eat carbs. So I actually have done my own microscope slide, and I've done fasting. And my slide after I fast is like only good bacteria. It's amazing. So there's different tools that you can use. Now, I'm not a medical doctor. I'm not going to walk you through a fast. You get to do that with your doctor because I'm a dentist and I have to stay in my lane. But we have general recommendations. I'm not going to put you through a detox program. Again, I'm a dentist. I want to see you for the things that I'm trained to do. And there's other doctors that have spent years training in detox and doing all of these things. So we want you to go to the best practitioners that are the most qualified to really walk you through everything. And just like in dentistry, like there's so many nuances in dentistry. There's so much new technology. There's so many CE classes. I mean, we're lucky that we have 3 doctors because we all learn different things and we come back together and we tell each other. And I think that that's one of the things that makes our clinic so awesome is that we have 3 brains together. But you have to remember, medicine is the same, right? So you got to go to those doctors that really are up on all of this stuff, and I can help guide you in the direction, but they're the experts. So, so I'm, like I said, general guidelines, and I can make suggestions. But if you have a lot of other stuff or more complex stuff going on, then you're going to probably need to see a functional medicine doctor or a naturopath who can really maybe do some more testing and really work with you on those more systemic issues.
I'd like to comment on gum disease because gum disease can be caused by diabetes. It can be caused by vitamin D deficiencies. There's so many other things that can make that bone loss and that inflammation really cause you to lose your teeth or cause your teeth to get loose or what have you. And this stuff is systemic. And so we actually have a form, a list of all the things we want a blood test taken from you to go figure out where you're deficient with things. But it takes time to make sure that you're well balanced. And we like Dr. Taylor said, we really want you to be in the hands of a medical doctor because there's going to be some follow-up with that. There's going to be some follow-up, and we want you in the hands of someone who does this stuff day in and day out.
Yeah, and true health is really having a team, right? Like I said,
Yeah.
like we can't all be amazing at everything, right? So we all have to kind of pick our kind of specialty or our area of expertise. And I think that we are here to kind of be your quarterback. And there's been a lot of patients that have come in and I'm like, you need to find a different doctor because your doctor doesn't know anything about this stuff. Or you need to find a different chiropractor because they're making your headaches worse. So there's that happens, right? So it's not, they're not all the same. And I think we can help you identify, if somebody comes in and they're like, my doctor said this, sometimes I'm like, well, that just doesn't quite add up. I think you should go get a second opinion, right? So we're here to support, we're here to help guide you, but we also have to stay in our lane as dentists and do what we're trained to do. So
There's another question is, there was another one before. Do you test for material compatibility before dental work?
if you want. I think it's a good idea. It's a blood test. There's extra cost and time involved. So if you come in and you're in an emergency situation, you probably don't want to wait a couple weeks until you have dentistry done. We have picked all of our materials to be pretty generally across the board compatible. However, we do see on tests sometimes that people are not compatible with them. And so if you're a sensitive person, if you are investing a lot of money and time in your dentistry and you want to make sure you want to go to bed at night knowing that these materials were good for your body, or not good for your body, but they're not going to create an immune response, then I don't think it's a bad idea. It tests for over 700 dental materials and you get to keep that and have that your whole life. So if you ever need anything, you can refer back to that list. So I don't think it's a bad idea. It's not required in our clinic because we don't make people, if you come in and you're not worried about it and you're not sensitive, some people are very chemically sensitive and other people are not. So we give patients a choice. We offer it as a service, but we let the patient decide. And sometimes I tell the patient, I'm not touching you unless you do that, because I look at their medical history and all of the other things they're sensitive to. And I'm like, we better make sure we are crossing our T's and dotting our I's here, right? But we do quite a bit of it. And we work with a lot of patients that are very chemically sensitive.
And one of the things is that we try to use as much as possible the most biocompatible materials. It is very difficult to find something that is chemically free. It's impossible. But we try to get the most compatible materials as possible. There is another question that says, do you remove mercury fillings using the SMART protocol?
Oh, I love this question. Well, I was trained to do mercury fillings before the SMART protocol was invented. So, my initial training was actually through the IOMT, which is the same organization that does SMART. But I think my training is actually more thorough because I had to go through about 1.5 years of training with them to become accredited with them. And then they decided that they're going to make this called the SMART protocol, which I think Dr. Isabel has gone through as well. So we do all of those things plus more. We've actually upped our game and we do even more than what the SMART protocol does. So yes, we have a great mercury removal process.
And the SMART protocol, for people that don't know, is the smart way to remove mercury fillings. Is the safe mercury amalgam removal treatment. And what we do is we make sure that our patients is completely covered, they're breathing oxygen, so they're not exposed to the fumes of the mercury. Then my assistant and myself, we are also protecting ourselves. So we use a special mask, we gown ourselves. So we do really good way to minimize the exposure for the patient and for the staff and for myself. And then also we use a lot of suction that is outside of the patient. There's many steps that are involved in the SMART protocol to make sure that we're safely removing this amalgam or this mercury fillings.
And just for those of you who don't know me and my story, I actually bought Green City Dental before it was Green City Dental. It was a very old dental office and it had shaggy carpet. And I ended up getting mercury toxicity poisoning. I had hives all over my body and they were so itchy. And I was like, what is going on? And I went to doctors and nobody could tell me what was going on. They wanted to give me cortisone. And so anyways, I went down this whole rabbit hole because of my health and I eventually had a metal test done and my mercury was off the charts high. And I grew up in a house that was mostly vegetarian, so I didn't have a ton of seafood. So it's like, I never had a mercury filling in my mouth. So I'm like, where did I get all this mercury, right? So actually the mercury removal process was really important in my detoxing of my own body. And that's actually, I wanted to protect patients once I learned about the dangers of mercury, but even more importantly, I wanted to protect myself and I wanted to protect my future children. And so it's definitely something that I'm passionate about. I think I just don't know why it's not like, I don't know how it's possible in our profession that we still think it's okay to put mercury in people's heads. And when you remove it, you're creating a ton of vapor and 80% of that goes right into the lungs and gets into the blood, which can convert and pass into the blood-brain barrier. I find it crazy that I can take mercury that I buy from Henry Schein or our supply company and I can either put it in your head, but I cannot put it in the garbage can. I just think it's nuts. So anyways, I don't think it should be used at all in dentistry. And I think if you have it in your head, you should have it removed and then you should detox because it took me about 2.5 years to detox all that mercury out of my body just from my exposure. And when I detoxed, my thyroid completely got better. I had low thyroid. When I was in college, I had low thyroid. In dental school, I even went to the nurse and was like, I need you to test my thyroid. I'm so cold all the time. And they, of course, didn't do the right thyroid testing. So they were like, you're fine. I wasn't. I totally had low thyroid, but it was really interesting because once I went through heavy metal detox and I got all the mercury out of my body and the lead, by the way, there was very high levels of lead as well. And lead and mercury work together and they're very toxic when they're together. But once I got that all out of my system, my thyroid completely corrected itself. I no longer have low thyroid. I am not cold all the time. In fact, I don't even wear sweaters because it's too hot. And I honestly like my brain fog is better and I'm not so tired. I used to be one of those people that had to go to bed at 9 p.m. or I would feel hungover the next day, even if I didn't have a drink. And I would have to get my full 10 hours of sleep. And after I went through my detox, I now can like stay up 11, 12, wake up at 6, 7, and I feel fine and I have tons of energy. So but it's a process, right? It's not, a lot of people are like, oh, just take my mercury fillings out and then I'm all better now. And for some people, maybe that works. I had a patient, I removed her mercury fillings, and she came back and she said, my eyebrows grew back in. I haven't had eyebrows for years. She was so happy. So it can happen quickly, but if your genetics are working against you, like in my case, my genetics suck at detoxing. I suck at detoxing. I needed more help. So again, this kind of goes back to that individualized care, right? We can remove the mercury, but we got to get it out of your body too. And that can take some time.
That's awesome. And then going back to the individualized treatment, they're asking, how can I remineralize very small cavities when another dentist told me that I needed 5 fillings, and
Ooh,
then
love that.
I don't want to go through that. And so this is very individualized. We all need to look at what is it that we're eating, and just what we talked earlier. How is your nutrition? How is your systemic health? What's going on? How is your pH, the pH in your saliva? And then also, unfortunately, you can go to 4 different dentists and you're going to get 4 different treatment plans. But the thing,
Actually, Isabel, my thing is you can go to 5 different dentists and you'll come out with 6 different opinions.
yes, exactly. Unfortunately, but we have something at the office that is amazing for incipient cavities. We used to use something else and it was not giving us really good results, but now we are using something different and it's called Curodont. And if those cavities are on that first layer of the tooth structures, not going to the second layer to the dentin, we can remineralize that. Of course, we need support from nutrition, we need support from environment in the mouth, but then these are peptides that are going to help kind of create like a scaffold, and it will help draw those minerals in those incipient cavities. And we have seen within 6 months full remineralization where we don't see it on the x-ray. So it is an amazing way to remineralize those incipient cavities.
Yeah.
And you know,
oh, sorry. Like,
go ahead.
here's the thing. You can always drill on your tooth.
Mhm.
Once you put a filling in your tooth, you now have a seam. You have a seam between the tooth and the filling. And that seam over time, even if you eat the best diet, is going to break down. And when that seam breaks down, and so for some people it's in 5 years, and some people it's 20, and some people maybe 25. But when that seam breaks down, you now have to go back to the dentist. They have to drill that filling out and they have to put a new one in. And every time that happens, they remove a little bit more tooth structure. So what happens after this is literally the life cycle of a tooth. This is why I don't like sealants. I hate sealants. I will never do sealants on kids. Unless there's an actual cavity, why would you ever put a material on a tooth, right? If I can remineralize it, then I don't have a seam. That tooth is going to be much stronger. Once you drill a tooth, it can remove 65% of the strength of that tooth. So dentists, of course, we love fillings. That's how we make our money. But to me, it's about health. It's about the health of the tooth. It's about creating the integrity of the tooth so that it's mimicking your nature and we're giving you the strongest tooth that we can, right? So I feel like there's a lot of patients that come in or they see us and we're like, oh, you have a few spots, and then they go to other dentists. And we actually had a patient this week. She had 5 fillings done. And we saw her and said, we can remineralize these. And she went to this other dentist. They did 5 fillings and she came back to us. She's like, oh my gosh, I had 5 cavities, they said that they had to drill these. It's like, oh my gosh, we can't undo that, right? But if we put our remineralizing peptide on the tooth and we wait 6 months, decay does not progress quickly. This is a slow disease process. So 6 months goes by, we do an x-ray. If it gets bigger, then let's do a filling on it. Fine. But why wouldn't you want to start with the most minimal amount of care? Because in the long run, you're going to spend a lot of time in a dental chair. You're going to spend a lot of money on fillings. And that filling is going to turn into a bigger filling and then a bigger filling and then eventually a crown and then maybe a root canal. And so it's just this domino effect. So we want to catch things when they're small. We want you coming in when you think you have a tiny little problem, or coming in preventatively, right? So that we can catch these things. Can we catch them small? It's super, super easy to fix them. And we can make corrections to your diet, and we can dial in your vitamin D and make sure that you're getting all your fat soluble vitamins and your minerals and all of those things. But if we don't catch them early, then the only option we have is more aggressive dentistry.
I was going to comment that some of these dentists like the gal that went someplace else, they may not even know about curodonts. That's a possibility that they're not keeping abreast of the new developments that are happening in dentistry.
Yeah.
Yeah.
I'd say between the three of us, we're probably in at least a CE class a month learning and keeping up with all of this stuff. And that's, again, what makes us such an awesome clinic, is because we have three brains, and we have a hygienist who speaks and teaches, and she's always finding new products and bringing them back to us, and always very, very on the cutting edge in terms of where the research is.
I just wanted to mention one thing, and yes, indeed, the decay or cavities can grow slow, but I had a couple of patients where they started this very acidic diet. I had one patient that she, for some reason, decided that tomatoes was the only food that she was going to eat. And within 6 months, she got huge cavities that were not there 6 months before. And then I saw another patient that was doing lemon water all day for months. And then she also started having really big cavities. So acidity in the mouth is also a big part of decay. So we need to make sure that we are being aware that the pH in the mouth is important. We want it to be around 7, because we don't want these incipient cavities to get bigger and then get within 6 months really big, large cavities that maybe can start hurting or even go so bad that get close to the nerve of the tooth. Yeah, we have to be careful with that. There is another, okay, how does clenching and grinding relate to stress or hormonal imbalances?
This is a great question. And
That's a great
I could
question.
probably talk for a whole hour
That's
just
a
on this
big
topic.
That's a big topic.
Yeah. Okay, well, I'll give you like the 5-minute answer. And then if you want more, you'll have to come back for next month. So why do we clench and we grind? There's, again, this is like kind of like airway. It's multifactorial. Okay. Sometimes, Lyme disease can cause clenching and grinding. When girls go through puberty, a lot of the times, the estrogen that's released can also cause more clenching and grinding. When we're stressed, we can go through more clenching and grinding. If we have airway issues and our airway is closing up and our body goes into fight or flight, we tend to clench our teeth together, right? So there is all sorts of things that can contribute to clenching. However, the most common reason that we are clenching is because our muscles are not happy. Okay. And the other thing, so clenching and grinding are different. Clenching is when you bite down and you squeeze your teeth together really hard, but there's really no movement. Okay. That's a clench. A grind is when you are biting and you're sliding your teeth across one another. Okay. So a lot of people say like, well, I definitely don't clench my teeth. My husband doesn't hear me do that. Well, you're not going to hear clenching. Okay. Because it's just holding the teeth and squeezing them together really hard. And when we're sleeping, we can put a lot more force on our teeth than we can during the day. So, when I look at the etiology of clenching, again, we have to look at the individual, right? We have to look at your hormones. We have to look at where, what your diet's doing. We have to look at hormones. A lot of patients come in and they've already seen a naturopath and they already know what their hormones are. So we a lot of times can rule that out, but sometimes we can't. And sometimes I look at people and I'm like, you should go have your hormones checked before we do any kind of treatment here. So, but if the clenching and grinding is coming from the jaw, typically it's because of the bite and the muscles. Okay. Muscles, when they're unhappy, they talk back to us, and our teeth are rock hard. So the teeth are not going to move, but the muscles can move and the muscles will accommodate. So when you have a bite that is creating cranial strain, or you have a bite that is asymmetric or it's not functional, which means that there are certain movements that we look at in the jaw, like when you move your jaw forward, the front teeth should disclude the back teeth. And when you go side to side, the canine should disclude the back teeth. And when you go really, really forward, only your canine should hit and no back teeth should hit. So if we look at all of these specific things with your natural bite, we can identify if those muscles are angry. And I actually have a very cool piece of equipment. You can tell by now probably that I like my toys, my diagnostic toys, but I can do EMGs on the muscles to see which muscles are overworking, which muscles are overfiring, and do we have a jaw joint issue? Is this a muscle issue? And a lot of the time, what we find is that there's big muscle issues, and sometimes there's actual bony jaw joint issues. And all of this really stems from our bite. So I do a lot of TMJ treatment. The other thing with clenching is that a lot of times that can also stem from the pelvis. So whenever we're treating up here, we also have to work with somebody to deal with the pelvic issues, because patients will have pelvic tilt, or there could be some pelvic floor issues if you're clenching. If you're grinding, this comes more from the neck. So we're going to do our EMGs. A lot of times in those grinding patients, that side to side movement puts a lot of stress on those neck muscles. And so in that case, we might need to pair your care with some chiropractic treatment, especially upper cervical neck chiropractic, to really help get rid of that. But getting rid of clenching and grinding is definitely possible. And that's, yeah, it's really what my expertise is actually in the practice is all the bite stuff. So hopefully that answered the question. And like I said, I could do a whole talk just on this topic. It's really fun. It's also like, it's good to have visual aids for that. So it's very three-dimensional.
One of the things that I learned not too long ago is like with hormonal imbalances, the TMJ, the jaw joint, has receptors for estrogen.
Mm-hmm.
So if you're having an imbalance on your estrogen levels, then you might be having some consequences in your jaw. And then if we're going to go and look at that emotional part that I'm fascinated with, when we talk about grinding and clenching, which is bruxism, it's called bruxism, there is a huge connection with how is it that you're communicating? What are you swallowing? What are you not saying? What are those things that you want to say and you're not expressing? So there's a huge connection with oral cavity and what is it that we're not expressing.
Bye,
Very
Laura.
cool.
Have fun at dance.
Yes, have fun. Okay, I think we have time maybe for one more question. Maybe we cover a little bit about this one, but
Would you do the expand the palate one?
where is
So
that?
let me just go
Oh,
through these really quick. So
maybe.
this
Oh,
is
you know
from
what? Maybe you're
Gabriel.
receiving those.
So Gabriel,
privately.
fusobacterial overgrowth, this is the same as any of the periodontal stuff we're talking about. It applies here. Okay, we do salivary diagnostic testing if you want to specifically test for that. But to be honest, if you got that in your mouth, you got other bad stuff too. So the protocol is going to be the same. And if you have, any of the bacteria are going to respond to the protocol that we have. And if there's dysbiosis in the mouth, there's dysbiosis in the gut. We look at our microscope, we do salivary diagnostics before, after treatment. We make you better. Okay. Can you expand the palate of an adult? This is a polarizing topic among professionals. This is a complicated question because it depends on how much can you expand the palate. Yes, you can expand the palate. The palate does not grow, like it's kind of a pet peeve of mine, but like the palate, when we expand this way, we are not actually we're not actually growing the mouth how it's supposed to be. Okay, so our maxilla, when we're kids and we're growing and we're developing, the way that it grows is bone gets put down in the back and it pushes the maxilla forward and it pushes the maxilla down, and at the same time it's widening. So when we say, can we expand the palate? Well, sure, we can put a screw in there and we can force everything open. Do you think it's going to stay like that? Because that's not actually functional. That's not how we grow. So can you expand the palate in kids? Sure. But if I'm going to pick an expander to use, it's going to be one that mimics growth, right? We want to mimic the way that the maxilla actually grows. And again, it just drives me nuts right now with these dentists. They're doing all this widening and they have no clue about this AP position, the forward growth position, or the vertical dimension, right? It's like the jaw, it's not just about widening, right? This is about function. This is about the jaw joint being in the correct position. And a lot of people need more forward and they need more vertical, and might need a little widening, but for every millimeter forward growth you get when you're a kid, you get 2 millimeters in the back. So whenever I look at a case, I'm always asking myself, where are they deficient? And I've never seen a case that only needs widening like this. And there are different expanders. So studies show that if you're using an expander that's tooth-borne, you can get about 5 millimeters of lateral expansion. If you need more than that, then you probably need a surgical expansion, like a Marpi appliance, which they actually drill into your palate and they force that suture open. Personally, I would never do this treatment on patients because it is not functional, and we have no long-term studies on it. And I've seen a lot of patients that have gone through this gigantic expansion. They've widened everything. They have this huge space between their teeth. And now they're in so much pain and miserable. They have headaches. They have all these things. And their lower jaw is so far back. And it also causes their maxilla to cave in. So I think that word expansion, again, it's like kind of thrown around. And I guess it would depend on what your case is. If you feel like you need palatal expansion, like, well, where do we need growth and how much do we need, right? Because again, you might need a little bit or you might need a lot, and I don't know what's possible.
I think that's a good reason why we like to take a look at children while they're growing, because that's a great time to get in and facilitate some of that proper growth when we can tell that the kids are not developing the way that they were designed to grow.
Yeah, it's so much easier to address this whole, the maxilla is so underdeveloped, and what happens is then the mandible gets shoved back and the mandible doesn't grow. So if you have a deficient maxilla, your mandible is not in the right place either. So instead of focusing so much on widening, we have to look at this whole picture, right? It's not just one dimension. So in kids, they're actually actively growing. It's so great if we can catch them early and we can get them growing the right way and kind of catch them up to growth. In adults, this is harder to do. And we never can really grow, adults are done growing. So all we're doing really is helping remodel the maxilla and the mandible. But it is possible, but it depends how much. Depends on your case. It's individual. We use microbiome lab products. Yes, we love microbiome labs. Spore-based probiotics are awesome. In fact, next week a podcast is coming out talking all about this. So I would encourage you to listen to that. Our podcast is Your Mouth Matters, and you can find it on Spotify or Apple Podcast. And they're great products. We have different protocols, again, based on what we see. So going back to that fusobacteria overgrowth, if we know you have that, then we're going to put you on a 3-prong approach protocol first. We're going to kill off the bad stuff. We're going to seed with the good stuff, and we're going to bind and get the bad stuff out of there. And we see just by doing that, even if you did nothing else, even if you didn't change your toothpaste and you did nothing else, we would see changes in the oral microbiome just by using those products for 3 months. So they're pretty powerful. And like I said, the podcast is coming out next Wednesday on that. So make sure you listen to that. Yes, super familiar with Butanko breathing. That's the next question. Are you familiar with Butanko breathing and facial structure development? Yes, that's pretty much all I do. We have a myofunctional therapist here who's trained with Patrick McEwen, the Butanko breathing guy. And we work with a lot of different myofunctional therapists, and we work with kids. And we have another great podcast. It's called Foundations, and that's the orthodontic program we put together for kids. That's very function-based. And then we also do something called oralase, which is another really amazing procedure to help release fascial restrictions in the mouth and the tongue and help with breathing. So that podcast is called Oralase. That one came out maybe last month or the month before. So we have lots of resources on our podcast on all these different topics, even the gums. So I really put those together because I think it's important that patients are getting the information that they need so that they can make informed consent decisions, and that you can be your own advocate, So listen to the podcasts. If there's a certain topic that you want more information in, it's a really great place to start. And then if you want really specific information about your case, then come meet us, set up a consult. Let's talk.
I just added on the chat the podcast, so you can go in there and look. There is definitely amazing information in there. And we're getting towards the end. Last minute to get any questions if you have any extra questions. If not, we're gonna be doing this again next month. Thank you everybody for coming. And then
Thank you for coming.
we'll see you next month. Or
All
sooner
right.
at the office.
Yeah. All right.
Bye-bye.
Bye, everyone.
Bye, everybody.